Hey guys, I'm going to be covering the chapter 26 of necrotics and necrotic antagonists. And before we get started, I'm going to show you the reference I used, the Focus on Nursing Pharmacology of Amy Karch. There we go. And then we're going to be covering, like I mentioned, necrotics and necrotic antagonists. And now with necrotics, they're also known as opioids. And for the discussion of the class of the drugs, we're going to, for opioids, they reduce pain. But for opioids, they are class 2, meaning they have high potential of substance abuse and they can cause severe physical and psychological dependency. And discussing the mechanism of action, so the opioid antagonists, they block opioid receptors and they reverse the effects of opioids such as respiratory depression, sedation, and the psychotomimetic effects, and hypotension, and to treat the opioid overdose. And this causes like the respiration, the level of consciousness, blood pressure low, everything's low. And so the rational use for it is to, like I mentioned earlier, is to block receptor sites and to treat opioid overdose or to reverse unpleasant and adverse effects, and for any substance abuse for a relapse to happen. Some nursing interventions indicated prior to use are to ask the patient if they have any known allergies of necrotics or if they've taken any in the past, because there's only certain limitations they can take. I believe if they're an ongoing, they do like cyanoform, if I remember correctly from Ms. Arnold. So any known allergies, performing a physical assessment to find the patient's baseline and do a neurological status, and then include level orientation, and to monitor the vital signs and the pain level, and to do an electrocardiogram for the heart rhythm and everything, just so we can see the balance and see what the difference is in, like I mentioned, the baseline. Nursing assessment indicated the determined effectiveness of the assigned medication is whatever they didn't feel then, they'll feel everything now. So sometimes the symptoms I'll mention later, but the effectiveness, like the pain level has changed, level orientation has changed, the withdrawal symptoms. Hopefully the reduced effects of withdrawal symptoms appear, but it does interfere with the pain receptors. Some symptoms that can show the commonly seen for the medication are nausea, vomiting, sweating, tachycardia. The anxiety is high up because they just because of the environment they're depending. From blood pressure, hypotension, hypertension, and pulmonary edema. Some mnemonic helpful ways that I try to picture. If you guys are a fan of DC, and if you know who Wonder Woman is, if not, you can look this up. There's a scene on, I forgot which film, but there's a scene, it's like No Man's something, but basically she's at a war zone, and she gets up from the dirt pit with her crew, or anyways, she gets up from the dirt pit and starts walking to the towards the enemies. And when she walks towards the enemies, she starts moving in slow motion. And with opioids, you are in slow, and slow. So you're slow in movement, and everything's low. So when she walks, her arms go low. So then when that happens, like everything, like her heart rate drops, her level of consciousness, her breathing, heart rate, and that's very deadly because then people can overdose from that point. And when the bullets are coming at her, she deflects it with her arms, so she's feeling no pain whatsoever. And for it to stop, for her to feel the pain, it doesn't really happen in the actual film, but like let's just say she has, in order for her to feel the pain, she just has to mark an X. So for the X, it's called naloxone. So with opioids, there's an O. So you can imagine the O, like the bullet O, and then she can't feel it because she's an opioid. Like she feels no pain, but she's going low and slow. And when that happens, when she deflects, she makes the X, and that interferes, and that's the antidote for opioids. So when that happens, then she will experience pain. She will feel the adverse symptoms, unfortunately, but hopefully it won't do a relapse for her case. And so that's how I picture the naloxone is the X, and that's what stops the opioids. For to do what do you call it? To reverse any adverse effects of the necrotics. And so that, like I mentioned, the naloxone is a Narcan, and it's used as the antidote for an opioid overdose. And when that happens, sometimes when the patients just due to their level of consciousness and the stage they're in from the symptoms, they might have to do a readmission. It may trigger like clients to be aggressive and just project vomiting and exhibit withdrawal symptoms. But that's what I had for my chapter. I hope you guys enjoyed it, and I hope that helped. So remember, from Wonder Woman, so she's the opioid for now, like she doesn't feel any pain because she's moving low and slow in the battlefield. It's in slow motion. Just think low and slow. Think of her level of consciousness, how she's moving slow, her GI tract, so she might develop constipation because everything's moving slow. But when she makes that X, that stops the O, so that makes it the adverse effects. It reverses the adverse effects of it. So whatever she didn't feel then, she'll feel now. So she'll feel the pain. I hope that helped. And like I mentioned before, I'm just going to pull up my references that I used. Was the focus of nursing pharmacology, just so you guys know. All right, thank you.